Z Show.
A couple of things about Obamacare that I learned while I was driving with my father a little bit earlier today. First, it was Sean Hannity, who had a guest on the show. And he's a doctor, the head of a medical group, and he is suing Obama, or he's suing Obamacare in some facet. Because as the head of a medical group, he contacted a lawyer, and he had a lawyer work out everything so that he was compliant with Obamacare. And this had to do with employees and insurance for everyone, and to make sure that the medical work that was going on was being coded and being billed correctly. All that stuff. He put it all together and paid a lawyer to help make sure that it was done right. And then Obama comes along and says, oh, no, never mind. I'm not going to make you do that until 2 or 3 years from now. And so he explained that he wasted all that money because chances are it's going to change again in some facet if it's not outright repealed, and it should be. We really, God help us, we need to repeal this bastard. And so anyway, the doctor is saying that it could be changed or adjusted, and so he would have to hire a lawyer again to go through everything and make sure that it's going to be that they're going to be in compliance. Or if it gets repealed, then all that money he spent is completely wasted. Thank you, President Obama. What a freaking screwball. Unbelievable. And then my father was telling me that the cardiologist that my mom and dad see is being paid, of course, by Medicare. But Medicare was gutted to the tune of $760 billion, $750 billion over 10 years. That comes out to about $75 billion a year. And so Medicare is being cut on everyone across the board. And doctors are being paid a lot less. And so the cardiologist my parents see is charging $3,000 a year for the first person, $2,000 a year for the second in a family. So it's $5,000 a year to make sure that you can still see him as your cardiologist. And so my dad did a little digging around, and he found out that a lot of specialists are doing this. They call it concierge service, and you get the basic service, supposedly, but many doctors, the basic service would be free, like it's supposed to be for Medicare. It wouldn't require any out-of-pocket costs. But you can't find those doctors because they have closed their businesses to additional patients. And so the way in is to pay for this concierge services. And I don't blame the doctors. They're used to having a certain amount of income because of all of the years of professional work and study and becoming a doctor. Very expensive. They deserve the money. But of course, Obama and the Democrats are going to tell you, no, those doctors, they're being greedy. So I'll tell you what, the doctors are either going to get paid one way or the other, or they're going to retire. And then that's going to be it. And you know what I would do if I had a small business is I would cut everyone to 30 hours a week and hire a couple more people and 29 and a half or whatever the cutoff is, and hire a few more people and tell everyone, look, this is the way it's going to be until somebody repeals Obamacare, because I'm not going to be a part of it. I'm not going to play the game. I'm going to stay out of it as much as I possibly can. Now, there was another story Sean Hannity was talking about. We were listening to the Sean Hannity show while we're driving in the car. And I wish I could find this. I found something similar. But the woman's story is she ended up with cancer. And this was a number of years ago. And she had her health insurance. And she went to a doctor. And the cancer doctor said that, it doesn't look good. And you better get your affairs in order. Well, there's something nobody likes hearing. So she did some research and found a number of cancer specialty clinics that work aggressively on curing cancer. And she found out that there were a couple of them that her insurance paid for. And so she and her husband went to one of these clinics, And she went through the whole thing. You know, they change your diet around, and they have a regimen of medication and exercise. They do all this treatment, and sure enough, it worked. And she is now cancer-free. Well, a couple of years later, here comes Obamacare. And her health insurance gets canceled, of course. And when she gets the new Obamacare compliant policy, she did some digging and found out that none of the treatment that she got for her cancer would be covered. And she wrote an article, and she said if she had the same cancer circumstances today, she'd be dead, because the treatment that cured her is not covered by Obamacare, and she can't afford it. It's many, many tens of thousands of dollars. And of course, all of this is pulled back now because either people have health insurance that doesn't cover it, or they have Medicare that doesn't cover it. Do you realize many tens of thousands of Americans will be dying? And Sarah Palin put a name on it, called it death panels, but you don't need that name, you don't need that term to understand exactly what's happening here. They don't have the money. Medicare doesn't have the money. Obamacare does not have the money. And certainly the people who don't have jobs anymore, good paying jobs are gone, so they don't have the money. And Obamacare is just now getting started. And of course, the Democrats keep fighting against repeal. And Obama keeps saying the same thing over and over again. The Republicans are making stuff up. I just got another email from the Democratic Party, another advertising email, please send us money. And they were congratulating, it was sarcastic, of course, they were congratulating the Republicans in the House for voting a 50th time to stop Obamacare. You know, at some point in time, all of these dumbasses are going to realize what a mistake they have made. And I hope to God it won't be too late to undo Obamacare, to repeal Obamacare. But of course, there's a chance that it will be too late. And I wonder, of all these people who voted for Obama, the elderly, people over 65 who voted for Obama, and they were so looking forward to going on Medicare and having all that, because they would avoid Obamacare, so they didn't really care about Obamacare or how bad it might be. Of course, people told them how bad it would be, but they didn't care because I'm not going on Obamacare. I've got Medicare now, baby. Well, I wonder how many of those people who were singing the praises of Barack Obama and Obamacare and isn't this great, socialized medicine in America. Finally, we are going to enjoy the glories of socialized medicine. And how many of those people who have been on Medicare or just recently got on Medicare, and of course Medicare is reeling from a $75 billion a year cut, less money than it had before. Some of these people have got to be thinking, what have I done? I can't afford this. There are a lot of elderly people who cannot afford a concierge fee to see a specialist. What are they going to do? Because the doctors who don't require such a fee are going to be nearly impossible to set an appointment with if they're taking new patients at all. And the other thing that happened, my mother recently fell and broke her pelvic bone. It wasn't a terrible break. It could have been much worse. At first, we were concerned that maybe she broke her hip, but she's doing very well. She's out of the hospital, out of the rehab, and at home recuperating and better every day. I want to make that clear first. But when it happened, she was taken to the hospital emergency room. They had her in a room in the emergency area and made plans to take x-rays, which they did, and they found out, you got a broken pelvis, a couple of cracks in there. And so they admitted her to the hospital for observation. 1 day. That was it. 1 day. And so the next morning, they already had a rehab person up there getting her out of bed. And it was too soon, and her heart started racing a bit. So they called her doctor, and her doctor came in and he said, well, I'm just going to keep you here another couple of days so you can relax and we can monitor your heart. But if it hadn't been for that, the woman has a broken pelvis, and she's admitted to the hospital for 1 day, and the description was for observation. Not for a broken pelvis, for observation. And the reason for that is Obamacare and the Medicare cuts. And it's not just that one patient, that one instance. You see, the problem is if the hospital admits someone and the Medicare people, the people running Medicare and paying the hospital with Medicare funds, they're watching every penny now because of the enormous cuts. And so if they say, well, she probably didn't need to be there, but for 1 day of observation, so we're not going to pay for it. And then the hospital starts losing money. All of this is happening because of the $760 billion in Medicare cuts. So my mom is in the hospital, and my dad comes home after visiting her and puts together some dinner and turns on Fox News. This is the story he saw on television.
Ruth Felton is a real fireball, even in her 90s.
How long have you been coming?
Probably several years.
Several years. Do you feel it really helps you?
I hope.
When she was 95, she fell late one night and was taken to the emergency room in an ambulance where doctors found she'd broken her pelvis in 3 places.
They said that she would have to go to rehab and learn to walk again and to learn to function again.
But her daughter was told that would mean a skilled nursing facility, which is expensive.
She did indeed stay 3 full nights, and we were told that that was the criteria for having Medicare pay for the rehab.
There's a nasty catch, however. Many people in the hospital are not officially considered inpatients, but rather under observation.
Once they're in the hospital and in a bed for several days, getting care and treatment and medicine and food, wristband, they think they're inpatients. People have no idea that they're outpatients.
Ruth's daughters learned 10 minutes before her discharge that she was only under observation, meaning Medicare would pay nothing for nursing care and rehab, leaving them to pay a $17,000 bill. Many others paid tens of thousands more.
The Inspector General calculated that there were 600,000 cases across the country just last year alone.
And Obamacare itself contributes to the problem. Hospitals argue they're caught in the middle with the government challenging medical decisions and imposing fines under Obamacare if they admit too many inpatients and they return.
Hospitals are penalized for excessive readmissions, and that is for any patient that's admitted. That might be one of the reasons why physicians are more cautious admitting patients to the hospital.
The government also hires contractors, what some call bounty hunters, to go out and challenge Medicare claims as far back as 3 years, giving them 9 to 12.5% of any claim denied, creating a financial incentive for second guessing.
These claims are held up in the appeal process for about 2.5 years. There's over $1.5 billion that's tied up right now while hospitals are appealing these denials.
But the hospitals win 70% of their appeals. One doctor who studies physician practices in hospitals blames the government.
You get hospitals basically overshooting and keeping more patients on observation status because they know if they make the wrong decision and admit a patient that could have been put on observation status, they're going to face a penalty.
Now, Congressman Courtney has 136 co-sponsors from both parties for a bill saying any 3-day stay is entitled to Medicare payment for skilled nursing care. Meanwhile, Sherry Breyer has been fighting the Medicare bureaucracy for months and calls the whole situation a travesty.
Well, my dad was watching that on TV, and he couldn't believe it. But it answered a lot of their questions about why this was happening, why the treatment that they got at this hospital changed almost overnight. Here's a brief piece of audio with Herman Cain talking about how he would be dead if Obamacare was enacted before he caught cancer.
If Obamacare had been fully implemented when I caught cancer, I'd be dead, and here's why. And here's why. I was able to go to the doctors that I wanted to go to as fast as they could do the test. I didn't have to wait 6 months like you do in other countries. in order to get a CAT scan, and sometimes people die before they get the CAT scan because the cancer in my body was spreading so fast. But because I was able to get the treatment as soon as I could and to get the quality care that I did, that's what has me alive today. You ought to be able to make those choices if you get a serious illness, not some bureaucrat in Washington, D.C.
Now, you know, the more I think about this, the more I realize that those people who are on Medicare and who voted for Barack Obama are going to be, they're going to tell themselves, they're going to convince themselves that it's the hospitals and it's the doctors. They're going to say, well, I'm sure that Democrats are telling them, oh, no, those hospitals, they're being greedy. Oh, no, those doctors, they want so much money, it's ridiculous. But it's $760 billion that has been cut from Medicare over 10 years. That's about $75 billion a year. Here's an Obama senior advisor, former White House press secretary Robert Gibbs, dodging questions about the impact of Medicare cuts. This was about a year ago.
Argument that the Obama campaign makes that the $716 billion is all in cuts to providers and insurance companies, and it will have no effect on benefits or services to the beneficiaries. Let me ask my question. Medicare's own actuary of Medicare, not of the Romney campaign, says that's impossible, that you can't have the same services for $716 billion less. And let's put up some of what the Medicare actuary says. They say that 15% of Medicare providers will be unprofitable by 2019. 25% of Medicare providers will be unprofitable by 2030. And the Medicare actuary concludes, this is his quote, in practice, Medicare providers could not sustain continuing negative margins and absent legislative changes would have to withdraw from providing services to Medicare beneficiaries, merge with other provider groups, or shift substantial portions of Medicare costs to their non-Medicare, non-Medicaid providers. In other words, according to the actuary, Medicare patients, millions of them, will lose access to Medicare benefits.
If Medicare companies that are involved in the program continue doing what they're doing, which is inefficient. Let's take, for instance, wait a minute. The actuary says, in practice, Medicare providers could not sustain continuing negative margins. If Medicare providers continue to do what we're doing.
Okay. So you see, it's exactly as I said it was. Here's Robert Gibbs, and I'd forgotten how much I hate this guy, because he's not the current White House press secretary. What a lying, scumbag, scoundrel piece of garbage. Unbelievable how somebody can live their life and lie for a living. Psychologically, I would be a mess if my job was to lie to the public all day. And that's what that's what everyone in the Obama administration does for a living. They get paid for it. They lie. Unbelievable. So it's not Obamacare. No. And it's not, I'm sorry, I've been saying $760 billion in cuts. It's $716 billion. Still nearly $750 billion cut from Medicare over just 10 years. But it's not all that money being cut from Medicare. No. And it's not Obamacare. No. It's that the Medicare providers are doing something wrong.
Medicare patients, millions of them, will lose access to Medicare benefits.
If Medicare companies that are involved in the program continue doing what they're doing, which is inefficient. Let's take, for instance, wait a minute. The actuaries say the actuary says, in practice, Medicare providers could not sustain continuing negative margins. If Medicare providers continue to do what we're doing right now, under the old program, Chris, if a senior got readmitted over and over and over to the hospital for the same illness, they got paid every single time the senior got admitted into the hospital. Why not strengthen the benefit by adding preventive health care to it and trying to ensure that this patient gets accountable care and treated before they get that disease?
And if the providers don't do it, then what happens is, under your plan, this unelected board, 15 bureaucrats come in and they decide what Well, you're laughing at it, but that is it. The iPad.
I guess I'm laughing at your characterization of it.
Are they not an unelected? Are they an elected board?
They're medical professionals. They're people that we trust to make medical decisions.
Are they elected by anybody? They're an unaccountable, unelected board that comes in and will make decisions on what the providers and the hospitals have to do.
Because their decisions...
and Congress either has to vote it all up or all down.
Yeah. Well.
Wow, you know what? I just can't take it. It's all too much. God, this guy is lying outright because, of course, he's a member of the Obama administration. This is what Obama's people do. They are professional liars. They go on television and they lie. Stephanie Cutter. Nancy Pelosi. Harry Reid. And Robert Gibbs. Jay Carney. David Axelrod. Debbie Wasserman Schultz. And Barack Obama. All right, that's going to do it. Another Jimmy Z show in the can. I'll be back next time. Until then, from the left coast, Jimmy Z. Bye-bye for now, everybody.
The Jimmy Z Show.
If they just give treatment early, a breathalyzer, an inhalator, or an inhalator.
The Jimmy Z Show.